Why does seeing a primary care doctor feel so different depending on what country you're in? I'm a doctor frustrated with the system, exploring systems around the world and sharing what I learned. So let's compare what primary care actually looks like maybe in the United States, UK, and Germany. In the US, a primary care doctor is often responsible for 2 to 3,000 patients. Visits are usually 10 to 15 minutes, and doctors may see 20 to 30 patients a day. But the bigger difference is what happens after the visit. American doctors spend huge amount of time documenting visits, dealing with insurance rules, answering portal messages. Studies show that US physicians can spend nearly 2 hours on the computer for every 1 hour they spend with patients, which leads to a lot of after-hours work called pajama time. So, in the UK, general practitioners also have large patient lists, often around 2,000 patients or more, and their appointments are often about 10 minutes. The key difference is that UK GPs act as gatekeepers. If you want to see a specialist, you usually need a referral from your GP first. Germany looks different. German doctors often have smaller patient panels, sometimes 1,000 to 1,500 patients, and their visits tend to be very short, actually like 7 to 8 minutes. But the trade-off is that those patients see their doctor more frequently, so the relationship builds up over many visits instead of longer ones. And when it comes to specialists, Germany is much more open. Patients can often see specialists directly without a referral, while the UK is requiring referral, and the US sits somewhere in the middle, but it all depends on your insurance. So even though all three countries have primary care doctors, the actual job of that doctor looks very different depending on how the system is designed and how much paperwork is done behind the scenes. And if you like deeper conversations about how healthcare actually works, sign up for my free weekly newsletter. Link is in the bio.